Hey guys, hi, welcome to our live. I'm super excited to be here with you. I am Nina Hart. If you don't know me, I am an NBA president, and I am really pumped about the things that we're doing right now. And so I'm excited to be able to share some of that with you. This week, we are talking about service based opportunities for nurses. These are mostly business models. A lot of your careers are already doing service based nursing. If you're in education, if you're in private practice or in any practice where you're providing a service to a patient or a client, whatever you call them, that is a service you're providing. So today we're talking about service based business opportunities. And most nurses I find hear me say business and they immediately think, I need to do something totally different. I have no business experience. I need more education for that. I need to figure out what I would even sell. I need another certification. I need a business degree. And that is not what this is. Today, we're talking about skills that you already have that solve real problems. That's a service, right? If your car is dirty, that's a problem. You go and have it washed. The service is a car wash. It's that simple. You're already offering these services to your patients, to clients. You're already doing these things. You already have these skills. Your nursing license qualifies you and sets you apart as an expert already. So you don't need any extra degrees or certifications to do this. But what you haven't seen maybe is how those nursing skills that you already have, that experience that you've already gotten, is really able to translate into different opportunities for you. And these opportunities right now are literally limitless for nurses. I can't even express how many opportunities are out there for service-based nursing businesses right now. So today is really just about helping you see what's possible with what you already know so you can decide if this path would make sense for you, if this is something that you really want to do for yourself. And as I go through this, I just ask that you would kind of listen and see if any of these feel familiar, if you're already doing some of these things. That is probably the one that is the best fit for you. I have a lot of nurses who say, I can't decide where to start. I can't decide what to do. Listen to some of these as we go through them. See if one feels like, wow, I'm already doing that. That's exactly what I do now. And that is probably the one that would be easiest and fastest to leverage with your expertise. So that's the one I would recommend going with. So let's get started. Let's talk about what is a service-based business just a little more. We did talk about this briefly, but you're solving a specific problem for a person or an organization using skills you already have. So if you've ever thought healthcare is a crap show right now and there's got to be a better way to do this, that's what we're talking about. Or this same problem keeps happening and no one will fix it and no one likes this. My patients hate this. This is so dumb. This doesn't make sense. Why do we do it this way? You're already thinking like an entrepreneur. You're already thinking like someone who has the skills and abilities to solve the problem. You probably already have the solution to it. So we're going to go through several different categories and really talk about where these opportunities for service-based businesses fall. And then if you see all the different options, you can start placing yourself into a category that you're already doing. So consulting. This is what I do. I have a multi-six-figure, almost seven-figure consulting business that I've been running for 6 years. This is literally just nurses who understand at a high level how organizations work. You can consult with an individual and do a consultation. That's not really what I'm talking about. I'm talking about providing a proven process or strategy to an organization for the improvement of a specific area. So workflows, regulations, I do regulatory consulting, or education consulting, certain standards for healthcare. You can do accreditation like JCO consulting. So you're going to be reviewing charts, you're going to be looking at processes, you're going to be preparing for surveys, managing compliance expectations, you're going to be looking at quality of care maybe, looking at IT workflows maybe. So that could look like chart audits, documentation, support, team meetings and education. It could be lots of different things. But examples would be like a hospital nurse who's working on documentation improvement for reimbursement, could be infection prevention control program management, could be home health and hospice audits and eligibility reviews like I do. could be a school nurse, policy support. But, you're already doing these things in your role when you are helping improve processes internally. So if you're on committees, if you've ever opened a new program or started a program for improvement, you've already done this. Education and training. You teach, precept, do mentoring programs. You're constantly answering questions. You're always the one with the new orientee. This is an education service. You can do staff training, you explain processes, you set up an onboarding program or an orientation program, you do skills training, you create courses for competencies, you do the RN competencies for your role or your job, you do leadership training on certain areas, you're on the leadership team and you do education as part of your role. This is for you. Some examples might be like an ICU nurse who does training for smaller teams on responses or preventing near misses. You could be a med-surg nurse who does new grad transition programs. You could be an educator for structured onboarding programs or orientation programs, or a specialty nurse teaching things like safety, teaching medication error prevention. It could be that niche, right? And the more niche, the better. So don't worry about that. But if people are coming to you and people are being sent to you to be trained or learn, you're already doing this. And then there are also patient-facing services. So far we've talked about more organizational services as far as education and consulting, but you can be a patient-facing nurse service business. So if you're strong and you absolutely love working with patients and you're like, I don't want to give that up, this is for you. You educate patients, guide families, help coordinate care. Looks more like patient advocacy or care coordination or care navigation. This would be for you. You do health coaching, private consults, wellness services, IV hydration, lactation consulting, chronic care navigation. Those are all under patient-facing services that you can offer as a nurse on your own. So you can advocate helping families navigate hospitalizations, discharge planning, care coordination to facilities, or navigating like complex patients and complex care privately for people who need help. Or wellness nurses offering lifestyle coaching, lifestyle or wellness support or navigation, or chronic disease support or coordination. So this is really the part of nursing that people need the most in our communities. So this is more of a community-facing role where you're actually working with the individual patient. Maybe you're doing coaching or consultations to give them direction on how to navigate what they're going through. So there's a huge need for this and people will pay for it. Now, there's also just regular coaching, nurse coaching. This can be on a corporate level. This can be an individual level. But these are just nurses who guide others through some kind of change, decision, growth. You're bringing it out of that person. You're helping them see, where consulting, you're giving them a strategy. In coaching, you're helping them develop their own strategy. They're searching for the answers within themselves, and with consulting, you're giving them the answers. If that helps kind of clarify those two a little bit. But this could be just helping them move forward through an area of wellness, health. It doesn't even have to be that. It could be any kind of coaching. It could be career coaching, burnout support, leadership coaching, health coaching, business coaching, weight loss coaching. It could be any type of coaching is a service. But you're helping other nurses transition. You're helping leaders support new managers. You're helping wellness in a clinical standpoint, maybe. But if you help people think differently about their situation, or people are always coming to you with their problems to see what you would do, this is probably a path that would be a good option for you. All right. I'm referencing my notes if you can't tell, because there's a lot of categories and I don't want to miss anything. But operational systems and support, these are nurses who are problem solvers. They fix things in organizations that are broken. They improve workflows, organize systems. You're the chaos manager. You come in and you're like, this isn't going to work. We really got to solve this problem because it's making everything, the schedule's a mess, the supplies are a mess. This is you. If you're the one who comes in and does the cleanup here and does the problem solving, maybe that's workflow, EMR. maybe you'd be great at startup if you're opening a new clinic. Scheduling systems, like I said, if the schedule's a mess and you're coming in and cleaning it up, that saves organizations a lot of money. So that is a service you can offer. Quality improvement could be one of these, but clinic flow redesign, patient flow redesign, EMR workflow improvements, supporting new practices, new agency startups, staffing and operational structural support. These are things that cost organizations a lot of money and cause leaders a lot of stress, and there is a lot of need around these. So if you've ever said something like, this makes absolutely no sense, why are we doing it this way? This might be a good area for you, because your lane is probably cleanup and problem solving and chaos manager, firefighter, right? And those are real needs that we have in our healthcare system right now. So if that's you, please step forward, because we need you. Specialty skill-based services. So this could be something like you're an expert in a certain area. Maybe that's aesthetics, maybe that's OR, ambulatory surgery, legal nurse consulting, forensic nursing, informatics nursing, infusion services, foot care. These are niche specialty areas where a high level of skill or expertise is needed. And so you're really needed in that area. That could be a wound nurse, improving outcomes in facilities as a consultant. You could be an aesthetics nurse, building up your own client base. That could be a legal nurse, doing consultations and reviewing charts for cases, being an expert witness. All these are services you can provide as a nurse. You don't need to have multiple skills in multiple areas. You don't need to be a business expert. You need to have expertise in one clinical area that you can apply as a service. So those are some really in-demand specialty skill-based services right now in healthcare. Partnerships and contracted services. So you want to work with a company and be a partner to companies instead of building your own thing. And this is really like something that would be applying your clinical knowledge, but in like a more structured partnership with an organization in a more structured environment. If you are working with hospitals, if you've ever done EMR training or implementation on a large scale, this would be more of a partnership, because you're literally working directly with the leadership and the floor staff. You're working with everybody to coordinate this huge change management project or project management, change management, EMR implementation. Insurance utilization review. You might be working with a large team to get through auths at a larger scale of records. Could be health tech consulting. You work with different systems and different data analytics with healthcare agencies, or fractional leadership roles like COO, CEO, those kind of things. So that could be all of those type of things. So it also could just be, working with the EMR company directly, supporting legal teams, contracting with startups to provide services as a partner. Could be part-time clinical leadership roles in a fractional sense. But you don't have to build it all from scratch. You can literally plug your expertise into existing businesses as a partner and contract your services out. So that's another option. And then finally, we've got digital. So you could do software or digital support as a service. So that could be like teaching courses, digital courses, creating resources, supporting others. You want to be able to, if this is for you, you want to be kind of behind the scenes. You're going to have to show up in some sense, but you're also would rather be, you want to serve people, but you also don't want to be face-to-face, patient-facing, right? So you want to create. You're a creator. You like to support others through creating resources. And so this could look like courses and coaching. This could be a membership. I love memberships, right? And NBA. Group programs where you do group coaching, group training, group consulting from a strategy standpoint with leadership groups. Could be templates, digital downloads, PDFs, education, manuals, policies and procedure manuals. This area right here, I think I know of 100 different things you could do in digital and software as a service. EMRs are software as a service, like apps are software as a service. Licensing curriculums are software as a service, where you create an education program and license it to an organization. You don't have to deliver anything. You just make sure they have access to it, and you license it to them for a certain point in time, whatever that looks like, 1 year, 2 year, 5 years, however you want to set that up. But this area of service is absolutely limitless. I cannot make that clear enough. Any idea you have, the more niche, the better, is just gonna, with the tools that we have right now with AI and vibe coding and automatic coding through apps like Claude, Base 44, Lovable, is that what it's called? We've got tons of support in this area now that we've never had before. ChatGPT and Claude alone can help you build these tools, help you outline these things in seconds. So I cannot express how in demand these are right now. You could sell onboarding templates and offer consulting with it to implement those. You could run a group program with some live support, and that's how those creative type people get their people fix, right? By providing that one-on-one support. You could create recorded education, digital education, PDF education with optional one-on-one coaching. But you're creating this content, whether that be a software, whether that be a digital download, whether that be a policy and procedure manual. You're creating the content and selling it. And this is a lot of passive income falls into this area. Again, we don't even have time for me to talk about how lucrative and how much of a need there is for this type of content. But that type of content you do have to kind of create in advance, in person. So that may take more work up front, where coaching and consulting and some of these other services, you can dive right in. You can start today with an email address and a LinkedIn account. Okay. So the point is that all of these things you can do without leaving your nursing degree behind, without a business degree, without another certification. You're expanding how your nursing experience is used in the marketplace, is used in the healthcare industry. And so instead of just being assigned work, being assigned a section, showing up for 13 hours, now you're offering value-based solutions. So instead of one role and being plugged into this job description, you get to define who you work with, how you work with them, what you do, where you do it, when you do it. This is 100% within your control. And I love that about my business. Instead of being paid hourly, you are being paid for the value you bring. And I can assure you, the value you bring is worth more than what you make per hour. So this is for you if you see problems, you think in solutions, you need more flexibility than your current schedule is giving you, or you need more income and you realize there's no amount of shifts you can pick up to make enough money. If you realize I could pick up 3 overtime shifts and it's not enough, then you need to transition into business, because you've hit the glass ceiling of what you can do under an employment agreement. Okay. That's where we're at. Or if you just need to have more control, you can't work underneath the restrictions that employment is putting on you, and you're like, this is just not working for me anymore, and you're open to using your experience differently, this is probably a good time for you to transition over. But you really have to be willing to take action. And so that's where I find a lot of nurses just aren't ready. So if you're willing to do something different, this could be for you. This is probably not for you if you want to make $1 million overnight, because that's not going to happen. I mean, it's highly unlikely that you would start doing something like this today and then tomorrow have $1 million. It just doesn't really work like that. If you don't want to deal with people, if you're feeling like you're still just not ready for a change, then you're probably not ready to take action in this area. It really does require a kind of scary step to put yourself out there. In any service-based business, in order to provide a service, you have to put yourself out there. If you're not willing to be seen by people and deal with people and work with people, have conversations, you're just not ready for this. And there's nothing wrong with that. You will be ready when you're ready. And that's okay. Just accept that and say, okay, I'm not ready. But if what I've talked about has helped kind of open your eyes to the options, hopefully you're feeling that like, wow, I'm already doing some of that. I'm already providing these solutions. But we didn't build that out today. We weren't able to get into the brass tacks of what that looks like, what your services are, what your offers are, what your pricing structure is. And so I really want to be able to do that with you. And it's not possible to do that in one 20-minute training. It's just not. So I need more time in order to be able to do that. And that's what we're doing in Nashville. If you don't know, we're having a workshop May 1st and 2nd in Nashville. I am super excited about it. It's Build and Launch Your Six-Figure Nurse Service Business. And we are talking about and dealing with all of these things. We're going to go through it. This is the binder that I've been building this weekend to prepare. It's got everything in it you need to launch. I'm super excited to be able to offer this. We've had a lot of requests for more live and in-person events other than the conference. So we are listening and we are doing that. And all you have to do is show up, have your idea, know where you fit, and show up. So we're not just talking. It's not like a conference. It's a very small room. We cannot fit more than 30 nurses in this room. There's 35 seats, me, our NNBA team. We've already had multiple people sign up. We've had several VIP members sign up. That comes with more one-on-one structured coaching before and after the workshop so that you have everything you need to start and finish strong. But we're literally going to build your 90-day launch plan in the room. We're going to build out your services. We're going to talk about all the deets, invoicing, contracts, literally visibility, how to get clients, building momentum, getting accountability, all of those fun things. And we're going to actually do it in the room instead of just talking about it. We're not going to like inspire you. That's what today was for, was to inspire you that you can do this and you do have the skills already. But this workshop is to actually build it out. So we're sitting down, building out your service, talking through who you help, how you help them, what you need to do to get to the point where you're ready, to serve clients. And so I'm really, really excited about this event. It's going to be fun. First of all, we're going to have a great time. We're going to have great minds in the room together. And I think that's really, really underestimated and undervalued. So I'm going to put this in the caption here so you can see the link if that's something that interests you. It is our Build and Launch a Six-Figure Business workshop, and it's coming up. I'm typing it in here, sorry. And it's coming up soon. We do have seats left, and I do want you in the room. So if you're thinking about it, you can email me, Nina at Nurses Business. You can email Casey at nursesbusiness.com. Ask your questions, but we do want to see you in the room. We do want you to have the help you need. If you've been feeling stuck, this is probably for you, because this is how we are going to really like move you through the barriers that you have. Like, I don't know how to start. I don't know what to offer. I don't know what to price. I don't know what my contract should be. I don't know how to invoice. What does all these business pieces look like? We're doing that together. We're going to work through all those pieces. So if you want help with that, if you're feeling like you need more help with that, we're going to help you with your next steps, a 90-day launch plan, and I would love to have you in the room. So any questions on that, the link is here. You can also find it on the website. So just go to nursesbusiness.com and it's under events. So again, that's easy to find, nursesbusiness.com, drop down the little events tab and you'll find our Build and Launch Nashville 2026 workshop. So I'd love to have you there. Thanks for being on today. I'm going to go back through and read all your comments. I want to hear what you have to say about these opportunities. If you're doing one of these service-based businesses and you've been on this, drop it in the comments. I want to read about what you're doing. I want to hear about what you're doing. I want to support you. If you're not a member of the NNBA, we support hundreds of nurses who are doing support-based businesses and who are doing 6 and even 7-figure businesses. So we want to support you as well. Let us know how we can do that. And thanks for being on today. Bye, guys.